Nowadays, as the technology keeps increasing, for the joint replacement has come a long way. We have robotic technology has evolved a long way. Implant design has come a long way. We are using PCL, ACL ligament retaining implants as well as minimal bone cuts, and we have seen so many advances in arthroplasty surgeries. At the same time, it's my goal to give them a natural knee. The natural knee is always a better option. Many patients don't want to undergo surgery, but they want minimally invasive procedures. So nowadays, the trend all over the world is shifting towards very minimally invasive procedures. Like at Germanten Hospitals, bringing that philosophy, technology in here, we are doing certain procedures which are very minimally invasive. Like instead of completely replacing the joint at the up to grade 3 of knee osteoarthritis, we can preserve the joint by using Chondro Filler or cartilage transplant. Cartilage transplant is a kind of surgery which is very minimally invasive. Chondro Filler is a kind of artificial cartilage paste developed by German doctors. So this kind of technology we are using here. So this prevents the joint from undergoing knee replacement and increases the joint up to 10 years more. So definitely this kind of technology, people can go back to sports, they can do activities, certain activities which they are not able to do for after knee replacement, they can do after this kind of